What are the long-term health risks for children conceived by IVF? Imagine a future where families can plan their children's health from the very start. Many parents choose in vitro fertilization to build their families, but what about the long-term health of these children? Let's explore what current research shows. Children born through in vitro fertilization often do well in their early years, but some studies suggest there might be small health risks later in life. For example, some research indicates that these children could have a slightly higher chance of developing high blood pressure during childhood. They may also have elevated blood sugar levels, which could increase the risk of diabetes as they grow older. There are also findings that some IVF children tend to have more body fat and their bones may mature faster than usual. These factors could potentially lead to heart disease or metabolic issues later on. Another area of concern is congenital malformations or birth defects. Some studies show that children conceived through IVF are a little more likely to be born prematurely or with low birth weight. These early challenges can sometimes influence health down the line. For example, heart defects or digestive system problems have been observed at slightly higher rates in IVF children compared to those conceived naturally. When it comes to cancer risks, the evidence is less clear. Some early studies suggested a possible link between IVF and certain rare childhood cancers, but larger, more recent studies have not confirmed this connection. Overall, the risk of cancer does not seem to be significantly higher for children conceived through IVF. There is also ongoing research into epigenetic changes. These are modifications that affect how genes are expressed without changing the DNA itself. Some of these changes have been observed in children conceived with assisted reproductive technologies, including IVF. While scientists are still studying what this might mean for health over time, current evidence does not show a direct link to health problems. In terms of growth and development, most IVF children grow and develop normally. Their height and body mass index are similar to children conceived naturally. Some research notes that children conceived through IVF might visit the doctor more often, but this could be due to more careful health monitoring rather than actual health issues. For families considering IVF, it's important to understand these potential risks. Genetic counseling can help evaluate if inherited factors might influence health outcomes. Regular health checkups for IVF children can catch any issues early. As technology improves and more long-term studies are done, our understanding of these risks will become clearer. In the end, while there are some modest long-term health considerations, the benefits of IVF often outweigh the risks. Being informed and working with healthcare providers can help families make the best choices for their children's future health.